The CQC completed a fully comprehensive inspection of AWP in early summer through 2016. During their inspection, they were really clear about some of the areas that our organisation needed to improve on. As part of our journey, we were clear that we needed to have quality and improvement at the core of everything that we do, and that we needed to understand what the CQC were telling us during their inspection feedback. The CQC are now coming back to us later on in this month, and they're going to complete a focused inspection of our services. That means they're going to come back to the areas that they let us know we needed to improve on, and they're going to check whether we've made those changes and whether they are embedded and sustainable. I think we're in a great position as an organisation to show those changes and to be really confident that we have services that we deliver that we can be proud of. I'd like to talk about a few of these areas of improvement. One of these areas was our places of safety, or our 136 suites. When the CQC came in 2016, they said that they were not satisfied that we could keep people safe within those areas. The CQC told us that they were concerned about our lack of governance, and more importantly, that people were staying in our places of safety over the 72 hours that they are allowed to. We have places of safety in Bristol, Swindon and Wiltshire. So what we did was we had a very clear project that we wanted to improve those services as quickly as possible. Some of the improvement was outside of our ability to change, and we needed to work very closely with our health partners in the police, in the local authority, and with our colleagues in the CCGs to make sure that we came up with a solution that would have long-term benefits. However, there were areas that we could change. We made some changes to our RIO, or our records. We made changes to the way that we had oversight and governance on the way that people are being detained. Subsequently, those changes are now embedded, and what we've got is a system that absolutely keeps people safe. We know this because we have not breached the 72-hour rule now for over a year. And also, we know that the amount of time that people are staying in police stations as an alternative to 136 is reducing. So we are confident that we can show the CQC that we have sustained these changes and that we can make a difference when we really try. Another area that we needed to change was that the CQC saw they had variation across our organisation. An example would be we would have one ward that seemingly was working really, really well and they saw innovation. And we might have another ward that seemed to be lagging behind. Obviously, we are one organisation, so that kind of variation we needed to do something about. The CQC also struggled to see sometimes how we showed our learning. So if we had an unfortunate event, how could we turn that into something positive to ensure it never happened again? So we developed a quality improvement plan. Quality improvement plans are now used across our localities and also at trust level. And what that does is it allows us to absolutely capture every bit of learning that we can. The CQC also told us that some of our older adult wards weren't as dementia-friendly as they would expect. So the first thing we had to do was you had to create a vision. So we wrote a strategy and we thought about what our dementia-friendly wards would look like going forward over the next few years. The next thing we had to do was you had to understand what good looked like. So we benchmarked, and we benchmarked against national standards. The next thing we need to do was to actually make some changes. So with those national standards, those benchmarks, we looked into all of our wards and thought about what those dementia-friendly environments should look like, and we made those changes. An example of that improvement would be signage, and that's dementia-friendly signage. So for example, every ward had up to 100 new signs made that made life easier for those using our services. Of course, the important thing to say is that this isn't just about the CQC coming. This is about long-term improvement. So many of the changes that we've made, including changes to our governance, the way that we understand risk, or certainly the quality improvement planning that I talked about, These are sustainable changes that we expect will continue to carry on when the CQC have gone. What we have to do now is to absolutely make sure that all of our improvements are for the right reasons, which is that our service users and their carers absolutely benefit from everything that we do in providing the services that we do.